Hi, I'm Dr. Rudy Cashman, Fallen, Indiana, a neurosurgeon for 42 years, but only 39 years old. No, you can also call me Dr. Wellness. You know from my previous 15 books or so I've written and previous shows I put on here for the last 3 years or so, almost on a weekly basis, that down deep in my heart, you know, I'm a wellness doctor. I practice surgery, but deep down, I know I could get a lot of people well by coaching them. And I actually have great news tonight. And my friends listening, I think, will be excited that on July 1, I'm going to be working full-time for the Lutheran hospital system, and will be directing essentially 8 hospital wellness program. I mean, to me, this is really, what have I been trying to do? I mean, I have to, I don't compliment necessarily Lutherans for choosing, but I like to really compliment the Lutheran hospital system for recognizing how important wellness is, and that they'll have the best of scientific care, but also the best of prevention and teaching patients and the employees good health habits, and that we can avoid a lot of medical illness and treat them, and even cure some patients with wellness. And this program is going to be about, I think, 3 or 4 programs I'm going to have here, and it'll be medical, nutritional, prevention, and therapy. In other words, what am I saying? Is that we can treat and prevent a lot of medical illnesses by proper eating and nutrition. And the hospital system obviously recognizes this, and we're going to be working together to try to achieve this. And I must say, I've been kind of walking on a cloud since I was offered that position. And so Dr. Furman, who's written many books, Eat to Live, End of Diabetes, came out recently. My name is on the back cover because I reviewed it. And I was just at a camp in Italy last week where we had 25 people where he taught this. I attended it again. And it's about nutrient eating. The food pyramid, which I designed, as you see on the screen, is really about nutrient eating. If you look at the bottom, that is cruciferous vegetables. You can see them. Next up, you see fruit. Then to the left of that, you see beans. And above that, you see nuts. And to the left of that, you see 100% whole grain. And then you see some meat on top. I mean, what am I saying here? What am I really saying here? Is that good eating does not involve eating meat 7 days a week. I mean, and I'm not saying you shouldn't eat it at all, but maybe up to 3 times a week, perhaps. You can have some portions of meat. And why am I saying this? Because meat has no nutrients in it. What are the nutrients? Vitamins, minerals, and phytochemicals. But you look, even today, when you eat fish, you say, well, fish is a great food, and I eat it 7 days a week. Well, fish is farm-fed. What are you eating? You're eating corn. It saddened me. Last summer, I remember trying to find a good place to eat, and I went through 60 fast food restaurants up in Goshen. I couldn't find a restaurant. I finally found a restaurant, and he said, well, we have salmon. So I ate the salmon, and it tasted like corn. It came from a farm. I really didn't believe it, that a person could taste that, but I asked someone else, they felt the same way. So it needs to be from Alaska. Meat products are not your friend. Not you can eat some of them. And the other thing we try to avoid is sugar. Because why avoid sugar? Because sugar in the end, especially fructose corn syrup, goes to the liver, is converted to fat. So you have fat from animal products. Animal products are full of fat, some 30 to 40% saturated fat. We need some fat, 20% of fat, 10%, 20% we need. But Americans are eating the mad, sad, toxic American diet, and we're eating a 40% fat diet most of the time. The 1970s and 80s, the government and cardiac associations were recommending a 30% fat diet, and that didn't really seem to work. But for one thing, the reason it didn't work, not because, because it was too high. They needed to have reduced it down to 20%. So it's a combination of fat and sugar. These two things together are ruining our health. The health statistics in the country are extremely poor. 70% of the people in this country are overweight. 40% are obese. And now we have a tremendous number of overweight children. 1/3 of the children are obese. There's certain ethnic and racial groups, because they have certain genes, where 90% are morbidly obese. Almost not believable. 1 in 2 people now have type 2 diabetes. That's where you have too much insulin. With type 1, you don't have enough insulin. And type 2 diabetes generally related to your weight. With new medical nutritional therapy, we can stop, prevent, and even reverse some of these diseases. In the next few tapes, what am I going to be talking about? For one thing, just to deal with plain old obesity. I'll tell you how to eat properly, how to lose weight, to feel better, look good, become more energetic, because fat on your body is like a gland. It doesn't just sit there. It secretes about 20 nasty chemicals. For example, the breast cancer rate almost doubles for improper eating, something that is not emphasized enough. I talk to many women. They have no living idea that you could cut the breast cancer rate 20 to 40% by proper eating. That's not emphasized. We're all looking for this chemical, this gene. That's the main cause of it, when the majority of the time it's just what we're eating. And so the fat on your body is a gland. Type 2 diabetes, we probably have 35 million people who have it right now, about 80 million people who are pre-diabetic. They're going to get it, but unfortunately during the pre-diabetic years, which are 10 to 15 years, because of high insulin levels in our blood, which doctors don't check enough for, the blood sugar seems to be normal, but our insulin level is elevated. So that needs to be checked. Best way to check it is a 2-hour postprandial glucose tolerance test. You take 75 milligrams of glucose and it tests you 1 hour, 2 hours. That will show the rise in the insulin level, although the blood sugar may not kick up that much. So that's pre-diabetes. And if you get you to lose proper weight and exercise, you can get rid of the disease. Type 2 diabetes is curable 90% of the time. Franklin House published a book called The 30-Day Miracle. He has it in there. Dr. Furman and I have our book, End of Diabetes, where my name is in the cover. Many other books. Max Hyman's latest book, Sugar Solution, I think is an excellent book to read also, as well as the works of Dean Ornish, Dr. Esselstyn, Dr. McDougall, Dr. Harmon, all wonderful books to read. I myself, on my website, Amazon.com, have books, CDs, audio books, all on stopping, preventing, reversing disease through medical nutritional therapy. And this works, so it's very important. But let me follow a little bit about my visit to Italy with Dr. Furman last week, who wrote the famous books, like I said, Eat to Live, New York Times bestseller list right now, and End of Diabetes, Super Immunity, another book I reviewed for Harper for him, all bestsellers, and they're right on the money because he teaches nutrient-dense eating. He calls it a To Terran diet, where you consider the nutrients in the food before you eat them. They got to have color to them, except mushrooms and onions are extremely healthy. They're extremely healthy and should be eaten almost by women, especially daily, because they cut breast cancer rate 40%. If you have a big slice of raw onion accompanied with a mushroom on top, you eat that every day, you'll cut it 20, 30, 40%. That's in the medical literature. All the things I'm going to speak about today are scientifically proven. And you can get the references on Firma's site or email me, and I will get you the references. This is not any speculation. Now what about are there certain stores or supermarkets that are already getting involved with super nutrient-dense eating? Yes. The Whole Foods markets, that's a huge, they have about 400 stores at least across the nation. John Mackey, the CEO, I met at a conference in Aspen recently. As a matter of fact, I sat next to him, and he's taken up a lot of the work of Dr. Furman, where he scores the food. He gives us a number called Aggregate Nutrient Density Index, ANDI scores. And if you go to a Whole Foods store, they're like kale, be 1,000 points, because of full of phytochemicals. We have vitamins, minerals, about 60, put them together, about 25,000 phytochemicals, plant chemicals, the carotenes, the sulfones, the phenols that are in these plants, and they lead to good health. They fought off the bacteria and funguses in the ground. Now you eat them, they fight off diseases for you. So they're extremely healthy. So let's talk about the ANDI scores a little bit more. Kale, remember, said 1,000. Mustard greens, 1,000. Turnip greens, 1,000. Collard greens, 1,000. But let's look at the other end. Vanilla ice cream, 8. Olive oil, you think olive oil is a wonderful health food. Wrong. It's 100% fat. But to take a tablespoonful every day, that's certainly fine to put it on a salad. But if you eat a lot of that olive oil, or any oil, plant oil, is absorbed into your bloodstream in 4 minutes. 4 minutes. Unbelievable. It hits your bloodstream. It gets through the mucosa of the gut that quickly. Fat, if you eat it, 97% will be absorbed into your bloodstream in 4 hours. And 97% will go to your buttocks or to your abdomen, and only you lose 3% of metabolism. But if you eat complex carbohydrates, cruciferous vegetables, we saw at the bottom of my food pyramid, you will lose 40% in metabolism. So you're only getting 60% of the calories because it takes that much work to digest the fiber. Fiber is your friend. Fiber is your friend. Broccoli has a lot of fiber. For example, cruciferous vegetables are full of fiber, resistant starch, foods that are full of complex sugars are difficult to digest. You lose 40% in metabolism. So looking at the food and scoring them according to the glycemic index. The glycemic index is 0 to 100. Okay, white bread would be 100 because it's like sugar. You're eating white bread, you're eating sugar. But you eat beans, that's a 30. Okay, interesting enough, some wheat products are quite high in the glycemic index. They're as high as 72. So to eat a lot of wheat products, because they've only been around for 10,000 years, our evolutionary bodies, we have the bodies, frankly, of living beings, living humans of a few 100,000 years ago, maybe 1 million years ago. We have the same body. So 10,000 years of agriculture and farming and growing vegetables, there's been very little evolutionary change in our bodies. Our bodies change evolutionary-wise every 20,000 years, about 0.1%. So our bodies haven't changed very much. So here we are using refined products where we take the bran of the covering of a wheat kernel, for example, and all we eat is the endosperm, the sugar products. We're eating sugar. Our bodies are not used to eating like this. There hasn't been enough time in evolutionary time, and we're getting sick. We're getting sick because of it. The China study proved, where they studied different communities according to what they ate, the people who ate vegetarian type diet, they're very healthy. the black population in Kenya is eating a vegetarian diet, they don't get hypertension. They don't get obesity. Their cancer rates are much lower than ours. The heart attack rates in 1954, they couldn't find a patient with a heart attack to show the med students. True story. Yet when I was a resident in Washington, D.C., at Georgetown, and I saw rampant hypertension, rampant brain hemorrhages, rampant cancer in the same population. So is it racial? No, it's not racial. It's what you're eating. It's what you're eating. Eating different food products. And there are certain racial groups, South America, Africa, Asians, who have in them what's called a thrifty gene. They are the ones who could chase an animal, catch the animal, eat the whole darn thing, store the fat, and they wouldn't eat again for 6 weeks because no food was available. They lived, and they still have that gene today. So when, like the Pima Indians in Mexico, they have it. The Pima Indians in Mexico, very healthy. But as soon as they hit Arizona 20, 30, 40 years ago, they started eating the American fat, salt, and sugar. You know what happened? The Pima Indians of Arizona run a 90% type 2 diabetic rate. It's based on obesity. They're eating the wrong food. That their bodies have not changed through evolution. That they're rejecting that way of eating. So the standard American diet is 65% refined foods, where you stripped the coverings, the bran, off the grains. We're eating donuts and muffins. And what are we eating? Sugar. We're eating sugar. Remember what I said earlier? Sugar is converted to fat in the liver very quickly if you don't use up an energy. And that's why we're getting these wheat bellies and beer bellies, because we're eating refined food products. Alcohol will do it. Wheat products will do it. So 65% refined foods, the average American, 25% fatty foods, animal products, where they're 20 to 40% fat, marbled beef, for example, and pork is extremely fatty. Yes, chicken is like eating a donut. Well, why is that? Because it has no nutrients. Remember we spoke about nutrients? Chicken has got fat in it. It has cancer growth factors, IGF-1, insulin growth factor 1, which causes cancer, is found in meat products, and you don't want that. So meat eaters are much more likely to get cancer, diabetes, hypertension, strokes, colon cancer, prostate cancer, and cancers, frankly, of any type. So we're around 65% refined carbohydrates. We're about 25% meat products. We're about 10% unrefined plant food, fruits, good food, 10%. That's all. And maybe 2.5% wheat products. So we're eating bad food the majority of the time. And that's why we have this epidemic, which is going to break this nation. 1 out of 2 people have type 2 diabetes. Remember, that type 1 is where you have an autoimmune disease as a child or something, and your pancreas dies, and you have no insulin. You have the shots today, but even the type 1 diabetic must eat right, because he may make it on 20 units of insulin, but if he gains weight eating the wrong food, the type 1 diabetic, now he's going to take 80 units of insulin. Well, let me tell you something about insulin. Insulin may save their life, but insulin also causes inflammation of your arteries, increases the cancer growth factors, causes angiogenesis of blood vessels to tumors. So running an insulin level of 80, having to take 80 units every day because you're type 1 diabetic, you will also get heart disease, vascular disease, stroke, and dementia. The study called dementia diabetes type 3. Yes, because the insulin affects the brain cells and deposits ages. That's protein that hooks to high sugar and deposits in the brain cells and makes them sticky and you can't think. So a lot of dementia memory loss is due to type 2 diabetes, type 1 diabetes. To avoid that, eating a high-dense nutrient food, you can avoid a lot of dementia. Alzheimer's disease itself is not common. You know, people lose their memory at age 85 or so, 50% of them, some from the aging process. The friends and neighbors and relatives say, well, you know, Uncle George has Alzheimer's disease. Baloney to that. Majority of them is a dementia of aging, which can be avoided the majority of the time. I give lectures on that. If by eating correctly, exercising your brain, you can go to my website, Cashman Mind Body. There's a little brain lifting weights. You hit that, and it goes to a page that to give you 6 months to get through it. The amount of stuff I have on there about improving your memory, games to play, and 20 things that the longevity mind body index that lead to a good life. So Cashman Mind Body, the brain lifting the weights. Next page. Do a half hour of that every day. You'll keep a sharp mind. We have to exercise our body, but also our mind. And frankly, if you eat the nutrient-dense way of eating, like in the food pyramid I showed you, unless you get hit by a Mack truck, you're going to live to be 100. And I'm serious about that, unless you have some rare genetic disease. So cheese consumption, cheese is fat. So that's not on your eating list here, frankly. And you can get some vegetarian cheese, but a lot of cheeses are 80% fat. And they're milk products. They full of polysaturated fat, very unhealthy, paints your arteries, causes dementia, causes cancer. Now let's speak about soft drinks a little bit. That is the cause of 50% of the obesity in this nation. Yes, sugary drinks, and many of them have in those fructose corn syrup, extremely sweet. But if you drink it, it is not metabolized easily, and it goes straight to the liver. It's converted to LDL and deposited in your body in fat. I was looking at a CT scan the other day of an overweight individual with type 2 diabetes, come to see me about a back problem. They thought the back problem was more important than the thing that's really killing him. So I did a CT of the back to see how much degenerative disc disease they had, and I couldn't believe what I saw. But this is reality in patients who are obese. The fat that you see around the abdomen is not just under your skin, but on the CT scan, I could see it under the skin, about that much fat. But then, inside their abdominal cavity, every organ was enveloped and wrapped and getting choked by fat. The fat looks white on the outside, and you could see it. It was unbelievable. The whole inside the abdominal cavity was white. You see this liver sitting in the middle of it. People are overweight. We have in this nation, we used to be alcohol cirrhosis that we did liver transplants for, or at least that died of liver disease. The most common cause of death from liver disease today is cryptogenic hepatitis. That's fat. That's choking off your liver. You can't live without your liver, and the liver becomes extremely hard, and the fat grows right into the fat cells and scars it and surrounds it, so cryptogenic or lipohepatitis is extremely common. 30% of people who are overweight have, frankly, invasion of their liver, their body, their pancreas, their spleen, their bowels, surrounded in a bath of fat. When you look at the CT scan, it's just scary. And Dr. Furman showed it when I was just in Italy. I mean, it really very scary. So soft drinks account for 50% of the obesity because of fructose corn syrup. And these huge drinks, like Mayor Bloomberg in New York, was trying to regulate the size of the drink. He made a mistake. He shouldn't have regulated the size, but he should have regulated his tax darn stuff and put the money towards, it's like cigarette taxes. That reduced cigarette consumption. We could reduce fructose corn syrup consumption, applied the money to health care. I say tax fat, salt, and sugar. That's what's killing us. And we could provide the money to health care, and maybe people would wake up and start buying a healthier food products. And the government should not support, for example, corn prices, for example, because that's what fructose corn syrup is made from. And that is what our beef is eating instead of grass. And that's why they're so unhealthy. Then we eat the steak of the animal that ate corn, didn't eat grass. So a very unhealthy situation. The government's paying for it, and then they pay for the diseases. It's perverse. It's perverse. Deaths from heart disease have doubled and tripled over the last 20 years because, remember I said, high insulin levels cause inflammation of the arteries, and then because we have so much fat in our blood that the small fat particles in our blood invade our arteries and cause narrowing of the arteries and then thrombosis and clotting, and we have heart attacks because of lack of supply to the heart, and then we have strokes because it's plugging up the blood vessels. The sugar in the blood hooks up with proteins in the blood called something called AGEs, A-G-E-S, AGEs. And these AGEs deposit themselves in the small vessels of your legs, and then there's no blood going to the nerves, and then you complain of numbness and weakness, and eventually leads to amputations. We have in our body, incidentally, it's very interesting, I didn't know until recently, we have in our body 300,000 miles of blood vessels. I'll repeat it. We have in our body 300,000 miles of blood vessels. If you count the capillaries, I mean, it's to the moon. It's 10 times around the earth. And you can see where these AGEs will plug up these tiny vessels, and we get neuropathy. We get vascular disease. We get strokes, we get retinal disease. The most common cause of blindness is type 2 diabetes. We get heart disease. We get neuropathy of the stomach, where the stomach won't move. It just sits there because the nerves have been dead. And skin diseases are very common from type 2 diabetes. The most common cause of losing a kidney is type 2 diabetes. The most common cause of amputations is type 2 diabetes. The most common cause of inflammation of your hips and needing hip replacements and knee replacements, you know what it is? It's obesity. It's obesity. Because not only of the weight, but the vasculature is impaired to this area, but there are inflammatory factors inside fat that affect the joints directly. So there's inflammation. It's not just the weight. It's inflammatory factors in fat that inflame these joints. So one of the choices, for example, for knee arthritis and knee surgery, I think it should be offered weight loss, inflammatory medications, exercise. It's not just the easy road, the quick fix. Give me a new hip, give me a new joint. You should participate in your health care and treat some of these things conservatively. The cancer mortality rate has increased tremendously in the last 50 years. It was shown in the China study in multiple randomized studies. The nurses study multiple randomized scientific studies have proven that cancer rates are higher in overweight people. I mean, the Women's Health Study, 9-year study, 40,000 women found increased death from heart disease from eating. 50 epidemiological studies of refined grains indicated increased prostate cancer, colon cancer, and the breast cancer rates tremendously increased, and that needs to be emphasized. I rarely meet a woman that knows that. Rarely. Have no idea why the Cancer Society doesn't really stress this. That's something that could be fixed quickly. Exercise, nutritional, and the people that support cancer research should demand that some of the money be given to women to exercise nutritional teaching. That's a quick fix. That's a quick fix. It doesn't just need to be on research on a rare drug, which probably takes most of the time, $750 billion time you count it with a new drug. Then they got to study it for 10 years. I mean, the benefits are way down the line. Nutritional therapy, medical nutritional therapy can have results like in diabetes in a week. You lose 10% of your body weight in a couple of months. I mean, Dr. House's book, Franklin House from Oklahoma, for 30 years he's been running this camp, and Dean Ornish and Dr. Esseltine, they all have proven that vascular disease, heart disease is stoppable, preventable, reversible. So it's very important this be stressed to the patients, and that the best prescription I can write you today is knowledge. Knowledge. I'm trying to pass knowledge to you. That's the best prescription that I can really give you. White rice, which remember, that's high. That's a high in the glycemic index, leads to a great deal of vascular disease. See, the Koreans, Dr. Furman went to Korea. The government hired him to teach doctors how to teach diet to the people there. South Korea has a higher rate of heart disease, vascular disease, strokes, cancer than the U.S. Not believable. Hardly anybody knows. Why did that happen? They eat 40% rice. We knew that. And we know that's bad enough, but they exercised a lot. They worked hard. It didn't bother them. But then the Americans arrived. So now they're eating 30% of the mad, sad, toxic American diet. Now it's 70% bad food. And guess what happened? No surprise. They gained a lot of weight. And they have the diseases they're from. And Dr. Furman has been hired by the government to wake the population up. And he's been over there for a few months, and they pay him to do it. So he knows a lot about it. So when you look at it, I mean, the North Koreans, who eat a horrible diet because they have any food, okay, are defeating the South Koreans with American food. They don't need an A-bomb. They don't need an A-bomb. They got an A-bomb. Our food. They're killing their own people with American food. Very interesting. It's a true story. Yet very few people talk about it or know it. And white rice has been studied in Korean women and increased the breast cancer rate. High glycemic foods. Remember we talked 0 to 100 in the glycemic index. Directly related to increased cancer rate, especially in women. They speak about glycemic load. I mean, what is glycemic load? Remember we talked about glycemic index. Glycemic load measures the amount of a food that you are taking. In other words, for example, like a big potato would have a pretty good glycemic load to it. That's a lot of sugar. And I personally used to think baked potatoes were just a great thing, but if you come right down to it, because I came from a German culture, you know, that's what we ate during the war. That's a lot of sugar. That's a lot of sugar. Where are the nutrients? Baked potato doesn't have any nutrients. But I have one here and there, no big deal. But if you put butter on it and oils on it, and it's not a health food. And although certainly it doesn't have fat in it, but remember the two things in health that we need to watch. We need to watch the fat on one end, and we need to watch the refined carbs on the other end. They both together lead to bad health. And it's both. It's not just one. It's not just one. So we need to know the glycemic load, the amount of a potato, and the glycemic index maybe around 65 or so, and you eat, and the load would be this is one size potato and this is another. So it depends on the load a little bit on how much harm you're going to do yourself. Let's look at the glycemic load of typical objects. It's kind of interesting. White potato would be the glycemic load of 29 versus cashews, nuts, 2. While I'm on the subject of nuts a little bit, they're extremely healthy. Beans and nuts are very, very healthy. Why is that? They have polyunsaturated fat. Dr. Furman will eat 1 to 2 ounces a day. They have polyunsaturated fat in them. For one thing, they're high protein. You won't believe this, but plant protein is healthier than meat protein. Why is that? Well, because there's no saturated fat in nuts versus animal protein is full of saturated fat, a lot of fiber in nuts, for example, so you won't absorb everything if you're eating, say, too many nuts. You're not going to absorb them all. They're just going to go out in your stool. has plenty of fiber, plenty of good protein in it, and polyunsaturated fat, and has some omega-3 too. You need some omega-3, the good fat. We need some good fat because fat, essential fatty acids, omega-3, is what your lining of your cells, your 7 trillion cells in your body, that's what it's made from. Our hormones have some fat in them, and omega-3 is anti-inflammatory. So to take it as flaxseed or as a supplement, fish oil, quite healthy. I think the best would be flaxseed. And put it and do some juicing or smoothies. I think a good habit for breakfast is to learn about juicing and smoothies, because why is that? You look at the juicing, and if you mix enough fruits and vegetables in it, I mean, it's the phytochemicals. It's that 25,000 phytochemicals, and you're going to drink them in a concentrated form. Can you imagine how healthy that is? That's extremely healthy. It turns your appetite off too. The nutrients in vegetables, in cruciferous vegetables, for example, in nutrient-dense plants, in essence, a plant diet, turn your appetite off. You eat this way, you'll not be hungry all the time because you don't have that rise in blood sugar that makes you hungry. Remember, you eat, for example, a baked potato, your blood sugar, or some processed wheat, for example, your blood sugar will go sky high, and then it dives. You stop at a fast food store on the way to playing tennis like I used to do years ago. I ate some of those French fries, and boy, I felt better, after a hard day's work. And then I'd come out and play my friend Dr. Crawford, and he'd say, Rudy, you kind of lost your energy. What happened? Well, because my sugar dove down, and now I'm hungry again. That's the reason you don't want to eat these fatty foods, for example. Like white pasta would have a glycemic load of 21. I mean, not all pasta is bad, but a lot of it is sugary. So we have to eat high fiber pasta. We can't be eating pasta 7 days a week because it has a lot of flour in it, majority of the time, and you're going to gain weight. A mango, for example, has a glycemic load of 11. So you go down the line. Apple would be 9. An apple has in it about 500 healthy phytochemicals. A strawberry, 700. So these are really broccoli per gram. Per gram has more protein in it than beef. Yes, never believable, but absolutely is true. 100 grams of broccoli has about 30% is protein, and higher than beef products. So excess protein shortens lifespan and promotes cancer. Yes, because of what? I taught you that already. The insulin, growth factors, AGF1 promotes cancer, and this is what meat products have in them. Plant, I'm talking about animal protein, okay? And I gave a lecture down at Purdue not too long ago on the difference between plant protein and animal protein. I think the students were shocked. The class was over. They didn't seem to want to leave because they thought the information was important. And I remember I'm going to give a lecture again there soon. And I really appreciate those great students at Purdue. So protein intake is the key determinant of IGF-1 levels in humans. In humans. So if you're a big-time meat eater, you have increased cancer rates. You are very, and the most common modern diseases, of course, we're looking at blood vessel diseases. We spoke about insulin inflaming these vessels and causing vascular disease. Tumors and cancers are increased with eating a lot of sugar, a lot of animal products. And I like to again mention dementia and Alzheimer's disease. These are huge. These are huge. The dementia and Alzheimer's disease rate is much higher in type 2 diabetics. Remember, type 2 diabetes is caused most of the time by being overweight because it's the fat. It's the fat on the belly, actually, the majority of the time that does it. And most of the time, you could lose about 10% of your body fat, and that alone will make a tremendous difference in your blood sugar level. Matter of fact, if you decide to eat 90% of the time say 90% of the time, this nutrient way of eating, within the first week, you probably will need to cut your oral diabetic medication in half at least. You need to speak to your doctor and check your blood sugars frequently through the day. If they're dropping, you've got to reduce your medications. Dr. Franklin House will take the oral medication away in 2 weeks. He'll cut the insulin level in half in 1 week. Don't you do that without checking with your doctor. And their recommendations will tell them, I'm going to eat differently. I'm going to follow this 90% of the time. And Franklin House thinks he can get rid of that type 2 diabetes in a month. I say 2 months. Dr. Furman would say 3 months. 90% of the time, there can be tremendous improvement, and a significant, maybe over 50% of the people will get rid of their type 2 diabetes. No medications. We added at least 10 years to your life and 20 years of less suffering, because the last 20 years of a type 2 diabetic, what is it all about? It's about dialysis. It's about strokes. It's about living in nursing homes. It's about amputations. It's about blindness, inability to drive, inability to quit your job. It's about skin breakdown. It's about dementia, a horrible life. When you can avoid this through medical nutritional therapy. Medical nutritional therapy is what I'm talking about. Wouldn't that be tremendous? I beg you to do it. I beg you to do it. I've had myself, as a neurosurgeon, over 200 people who lost their type 2 diabetes. I have sometimes man and wife. Had one recently, one lost 20, other lost 22. No type 2 diabetes. I will admit, I've never met another provider who ever told me that they've seen that. And it's kind of interesting. And this is not difficult. It may be difficult to motivate yourself to do it, but believe me, I'm not an engineer, and I'm just, to me, an average guy. And if I can change somebody to do that, it is not difficult. And it's about exercise, it's about eating the right food, and then watching your medications. So in the motivation towards it, you have to meet a caring provider. He can't just write you a script. He's got to talk to you, and it can be a nurse practitioner, it can be a nurse, it can be your family doctor or internist or a diabetic doctor, or a surgeon like me, who, there's no doubt about it. I bug my patients. I may cure them treat them for their ruptured disc, but if I see they got a weight problem, got type 2 diabetes, I'm going to offer it to them. Actually, what I do is tell them, I'm now willing to be your coach for the next 6 months, see me once a month. And what I've done, I tell them, no charge. It's part of the operation. Well, part of the reason is it's a two-way street. They get better. They walk in there and they show me their skinny body and their belly looks ripped. And I mean, for me, that's a holiday, man. And I'm jumping up and down. And I've taken a lot of pictures of these patients. I can prove it to you. They're on my cell phone. Matter of fact, I asked a girl that works at Lutherans recently. It was a combination of me teaching Dean Ornish's and Furman stuff to her, and then, she was 400 pounds. And there was a little stomach stapling done by excellent surgeon at Lutheran Hospital. Really good at it. The combination of the two of us, she's coming down, I think, to 160 pounds from 425, I believe. I took a picture before. It's on my cell phone. And we're going to take a picture afterwards, and then take another picture. I mean, it's happening. I see her every day. It's happening. And look at the trouble we saved her. And but she feels the love of her doctors, no doubt about it. And a matter of fact, I offered to help her till we get this done. I even offered, because in the end she had a lot of extra skin that's going to be needed. She wants it removed, and I'm going to pay for part of that. And other doctors are too. So I think a wonderful story. It can be done. You just got to motivate yourself and have a loving provider. She wouldn't have done it if she hadn't felt the love of 2 or 3 doctors that ever dealt with her. She feels our love, and no doubt about it. So we have to do our part. if you want to eat like other Americans, you're going to be overweight, and it's abnormal to be thin. You look at certain families. I saw one the other day in the Japanese restaurant. They walked in, all 15 of them, all grandkids, father, mother, everybody was obese. I don't think they see it. Take your clothes off, and go in front of the mirror and have a look, a realistic look. And then visualize yourself 6 months down the line being much thinner. Visualize yourself, do it every day. See your body coming down. It can be done. I've done it for many patients. And you'll get rid of vascular disease, strokes, cancer, heart disease, amputation, kidney disease, blindness. This is medical, nutritional therapy. And it works. And we are providing it big time at Lufkin Hospital. I mean, I'm going to be Dr. Wellness there. And so they have embraced it. The hospital system has embraced it. The best of science and the best of prevention. Isn't that wonderful? I mean, the first few nights I thought about that, I could barely sleep. It's just wonderful. And especially we can reverse, and I think cancer doctors need to get involved with this a little bit too, because I've had programs on this before, that proper nutrition can prevent cancer. But a recent paper, scientific paper, proved that even if you have metastatic breast cancer, that nutritional therapy has value. In that Dr. Furman's course I took last week, there was a lady who has stage 4 breast cancer, survival rate 5% in 4 years, who in 5 years has gone 3 years now, and she does everything which I teach. She's a happy person. She has a loving hospital. She's enthusiastic. She eats the nutrient-dense way. She exercises. I get a feeling she's on the way to curing herself. I really believe it. And I took her phone number and gave her my email, because I told her, you got to keep on contact with you, because it's to be around her was inspiring. So we need to attack this breast cancer rate, and cancer doctors need to step up. And I'm going to beg them to push nutritional therapy and exercise, and to get involved, get the patients involved. It's not just pure science, and that's in terms of prevention and treatment. Even with metastatic disease, scientific papers have shown that it makes a difference if you're eating right. So, are you a nutritarian? That's what Dr. Furman would say. A nutritarian. Well, a nutritarian would be a person that eats high-dense nutrient foods. Okay, we have vegetarians, ones who don't eat meat products. Okay, the Seventhday Adventist, they live out west, and Loma Linda University has a lot of Seventhday Adventists there, and I have a friend who does that, and they live about 10 years longer than we do, although they still eat some cheese products. But I think they get away with some of that because they have on Saturday what's called the Sabbath. So I call my friend up to play tennis. It's Saturday. Saturday spent with the family, exercising, playing. It's a family event. So I think that Saturday also is part of healing. So it's spirituality and religion as part of good healing. So there's more than just food with the Seventhday Adventists, but they're living 10 years longer than we are. And Hans Steele out west, a German guy who teaches this also, who I met incidentally when Dr. Esseltine gave a course at Anderson, in Anderson, Indiana recently. Hans came along. He's published many books on the same thing as this, and I handed him 3 books I'd written, not about nutrition, other books about pain and narcotics and things like that. 3 days went by, and he was a fellow German, like I'm originally German, I speak the language. 3 days later, calls me on the phone, 10 o'clock on Sunday night, Doc, I've read your 3 books. I'd like to buy 200 of them. I could not believe it. I could not believe it. So Hans Steele, I love you, Hans. And he teaches this way, too, this way also. So a nutritarian is a person whose food choices are influenced by nutritional density. You must look at your food. Look at the food. That's mindfulness. That will result in you paying more attention to what you're eating. Look at the food. You know, we don't look at us. We don't look at the trees that are on our property. We don't really look at the children. We don't really look at the food. It'll slow us down a minute, and we pay more attention to what we're eating. So a nutritarian considers the food that they're eating, okay? And we maybe said vegetarian, again vegan. A vegan diet is there's no dairy products, no meat products, but they can eat they may eat a lot of wheat and things like that, and they can get overweight. So they need to pay attention a little more too to the nutrient density. But it's a good way of eating, no doubt about it. And so a nutritarian is a person who thrives for more micronutrients. Remember I said 25,000 nutrients, phytochemicals, remember the vitamins and the minerals. A nutritarian considers that and thrives on that. Incidentally, they turn your appetite off. They turn your appetite down. And nutritarian recognize that food has a powerful disease-protecting and therapeutic effects. So in essence, a nutritarian truly believes in medical, nutritional prevention and therapy. Isn't that wonderful? Isn't that wonderful to be healthy, to eat this way? And remember I mentioned earlier, incidentally, a review of 206 epidemiological studies showed raw vegetables have the most consistent and powerful association with the reduction of cancers of all types. 206 studies. Wow. Wow. You need them? Well, get them to you. Dr. Furman's site, and I'll lead you to these studies. This is not something we believe. We've proven it. It's been proven. And the information needs to be spread. The public is not really aware of it, how important it is to eat right to prevent all these diseases. I mentioned the word cruciferous vegetables earlier. And why do we name some of these vegetables cruciferous? Because their flowers, when they were plants, looked like a cross. So remember, at the bottom of my food pyramid, I have cruciferous vegetables from broccoli to cabbage to rutabagas, which I ate most of my life when I lived in Germany as a child. We had no other food available. So what are cruciferous vegetables? Kale. Incidentally, kale can be grown in the snow. I didn't know it till recently. I had one of these programs. I had Matt, who runs an organic farm close to St. Francis University. Mac Merritt, a wonderful young man. Go visit his farm. Beautiful stuff he has on there. He was telling me he's growing spinach and kale in the snow. So you can have that in your garden, and kale has get 1,000 points. Remember, in the phytochemicals, 1,000 points. So you can grow this in the wintertime and go back to your garden and just keep on eating it all week long. And how healthy is that? And other ones are broccoli, collards, broccoli sprouts, Brussels sprouts, watercress, bok choy, cabbage, mustard greens, arugula. He said a nice salad earlier today for lunch, and it had arugula and pears on it. I mean, what a wonderful lunch. What a wonderful lunch. It made me feel good. When you eat right, you actually feel good. When you eat bad food, you get raggedy. You don't feel good. When you eat nutrient-dense food, you feel energetic. You feel like going. I mean, considering my age 39, you might add another 38 on that. And I'm full of energy. Play tennis. I get a TV show. I write a book every 3 months. Work full-time neurosurgery. Give lectures all the time. Why is that? I'm eating the right stuff. I'm nothing special. I'm just doing what I'm trying to teach you. And I think it's a very important thing to remember. Red cabbage, that's another one. Kohlrabi, all cruciferous vegetables. So my food pyramid, remember I showed you, it's about nutrient density. The numbers I have on the right are not portions. They're nutrient density. Cruciferous vegetables are nutrient dense. The meat on top, I didn't say you should never eat it, has no nutrients. Eating chicken is like eating a cookie. You got to remember this. That's Dr. Furman's words. The first time I laughed, and everybody say it to a laugh, but it's the truth. It's the truth of the matter. And there's tremendous amount of protein in plants. Remember I gave a lecture at IU Purdue on and looking forward to the next one. The amino acids and proteins in plants are so much healthier because they do not carry fat with them, which animal protein does, and cancer factors. And let me give you an example of the protein content of plant foods. Now we're talking about frozen 1 cup spinach has 7 grams of protein. You should have about 50 grams of protein. Actually, it's about 35, depending on your size a little bit and whether you're an athlete or not. But 30 to 50 grams of protein per day is all you need, and you can easily get that from plants. Remember, it's no different. It's all broken down into amino acids. Plant protein, no different than animal protein. Once it's broken into the amino acids, the average American eats about 150 grams of protein a day. You only need about 50. But let me give you an example. Spinach, 1 cup, 7 grams. Collards, 2 cups, 8 grams. Peas, frozen, 1 cup, 9 grams. So you can see it's not difficult to come to 50 grams of pure plant protein without needing animal proteins. Almonds, 3-ounce almonds. You don't think you want to eat every day 3 ounces, so Dr. Furman, I think, does. Cashews is his favorite nut, incidentally. The healthiest nut, frankly, is Brazilian. I think it's Mediterranean nuts. Actually, the healthiest. They're hard to find. They're expensive. You got to buy them online almost. But we did find some, I think, one of the stores here recently. But they're a little bit expensive, but they're healthiest. Mediterranean pine nuts have the highest rate of protein of any nut. Mediterranean pine nut. Dr. Furman eats those. You can buy them on his site, but slightly expensive. And broccoli, 2 cups, 10 grams of protein. How about that, huh? Soybeans, 11. Chickpeas, 10. So sunflower seeds, 9. Incidentally, sesame seeds have the highest source of calcium. You don't need to drink milk to get your calcium. Matter of fact, no human should drink milk after age 2 because the type 1 diabetes rate goes up for children, for example, because of allergies to the proteins. Milk is the healthiest thing you can give a child, mother's milk, till age 2. Okay, absolutely the healthiest thing for brain growth because of omega-3s. Okay. And I mentioned again that cancers are associated with increased consumption of animal products, and almost all the cancers, but highest being prostate, breast cancer, intestinal cancer, kidney cancer, and animal protein raises cholesterol, cancer rates, promotes bone loss, animal protein makes the blood acidic. You suck out calcium to balance that and become osteoporotic, and you have compression fractures. So to summarize things a little bit here, what are we saying? That medical nutritional therapy through nutrition, that medical nutritional therapy and prevention through nutrition can prevent the majority of diseases. Unless you get hit by a Mack truck or have some genetic thing, the odds of you living to be 100 is quite good, and to be intelligent at the same time. Remember what I said? Dementia and Alzheimer's. Dementia is largely preventable, not every case. There are a few cases of Alzheimer's begins at age 45, and there's not much you can do. But the majority, you can outlive, be developing dementia supposedly half the people do at age 85, probably because of what we're eating. You can avoid that by these exercises that I have on my webpage, and eating properly. Nutrient density and exercising will cause neuroplasticity, brain growth. So you're going to have a very healthy life. America must change. I beg you to do it. And read some of the books I've recommended to you. And you can look at my website and you go Amazon Books. You can pick up a lot of my books, including DVDs, audiobooks. I'm starting to have a lot of audiobooks. We can play them in your car. People seem to really like those because, like me, you get bored listening to other stuff, and you can be educating yourself listening to something. Like today, I've been listening to all day one on migraine headaches, an audiobook I just put out there. So thank you very much. We love you all. Namaste. Please come to some of our other lectures and programs. And Lutheran Hospital, I love you for offering me this new job. See you at the next show.